Hello, I'm Yuqing Chen. This health promotion project is designed to prevent bowel cancer. First, many of you may know that cancer is a leading cause of death in Australia. And bowel cancer is the second leading cause of cancer death. It affects both men and women, young and old. In addition, in 2016, it's estimated that 30% of Australian population, which means 7.4 million people, will be diagnosed with bowel cancer. And now, around 80 Australians die of bowel cancer each week. This disease usually develops silently and without any symptoms. The risk factors of bowel cancer include unhealthy diet, such as high-fat and low-fiber food, and smoking, excess of alcohol intake, obesity, lack of exercise, personal and family history of bowel cancer disease or cancer. But only less than 5% cases are related to these factors. Other 95% of cases are related to aging, especially those who are 50 years and over. They have 20 times as higher risk of bowel cancer than other aged group. And here is a video about what is bowel cancer and how to prevent it.
Bowel cancer is serious but preventable. Over 13,000 Australians are diagnosed with bowel cancer every year. Bowel cancers are cancers that occur in the colon or the rectum, and the colon and rectum together are also known as the large intestine or large bowel and form the lower part of our digestive system. Our digestive system is a hollow tube that starts at our mouth and ends at our anus. Its function is to take food into our body and eventually get rid of the waste. The bowel is where the waste products from digested food are stored, and then eventually they are emptied from the body when you go to the toilet and pass a bowel movement. Bowel cancer usually develops from a growth of abnormal cells on the inner lining of the bowel. These growths are called polyps. Many people have polyps, the majority of which are benign and not cancer. But if left untreated, some of these polyps may become larger, and the cells within the polyps may change to become malignant. And at that point we call it cancer. When this happens, the cancer often grows and may block the flow of waste products through the bowel. Over time, the cancer is likely to spread through the bowel wall to other parts of the body, and increase our chance of developing bowel cancer include having had a previous history of polyps or bowel cancer before, having conditions such as chronic inflammatory bowel diseases, and by that we mean conditions such as ulcerative colitis and Crohn's disease, having type 2 diabetes, and of course having a significant family history of bowel cancer. People with even one of these risk factors should undergo close monitoring by their doctor, and some of these people may require regular colonoscopy tests. So it's important to start screening when people turn 50 years of age. Screening every 2 years using a fecal occult blood test kit is an important method for finding bowel cancer early. There is increasing evidence that lifestyle factors, in particular physical activity, body weight, alcohol, and diet, are also linked to bowel cancer. So, it is likely that individuals, by targeting those areas, can make positive changes to reduce their risk of bowel cancer. The risk of bowel cancer may be reduced by screening for bowel cancer every 2 years after the age of 50, being physically active for at least 30 to 60 minutes a day, and the more the better, achieving and maintaining a healthy body weight, avoiding processed meats, like ham, salamis, bacon, mortadella, pastrami, and those sorts of meats. Moderating red meat intake to palm-sized serves, no more than 3 or 4 times a week. Eating a well-balanced diet, of course quitting smoking, and avoiding or limiting alcohol intake. It has been estimated that at least 25% of bowel cancers could be prevented through eating a healthy diet, maintaining a healthy body weight, and participating in regular, moderate intensity exercise.
So yes, bowel cancer can be preventable. And if detected early, can be successfully treated in 90% of cases. However, currently, 60% of people who have bowel cancer were diagnosed too late. Thus, in order to prevent bowel cancer and increase its survival rate, people who are aged 50 and over should take the FOB test every 2 years. People who are aged 50 to 74 are our target group, and they will be sent a free FOB test kit every 2 years. The test kit will come with a brochure which contains relevant information of bowel cancer and how to use it. It is easy to use, and people can collect their stools at home. Then, post the samples back to the laboratory with no post fee. We will send the result back to them. If the result is positive, they will need a further test to confirm it is cancer or other disease. Government, community services, healthcare and consumers. Also, the media are the main stakeholders of this program. They are playing an important role on supporting the evaluation and acting on results and feedbacks. The short-term goals of this program are to increase the average participation rate of bowel cancer tests to 45% in 2016. The long-term goals are to reduce the incidence of bowel cancer and promote people's quality of life. A simple test at home may save a life and their family. So be smart, don't wait until too late. Thank you.